and then we'll do some introductions here. So good afternoon, everyone. I thank you for attending. This is the second offering of the RISE dashboard training, the introductory segment. We have the identical training segment on Tuesday, and so this is the second offering of it. As I mentioned before, it's a little bit shorter. We left open a bit more time for you to jump in and ask questions and interact with the presentation. So I'm going to be pausing periodically just to open up the floor to you. And what I would also encourage you to do is type into the chat box and or the Q&A box with any questions that you have. I'll be tracking that as I'm going through and see if there is anything that pops up that I can address while I'm speaking to the presentation. So hopefully we'll have this paced pretty well, and let's see how we do. So I wanted to begin this training with a few questions to you, and I hear these questions. Actually, I ask these questions a lot, and often hear them quite a bit when I'm working with community health centers. Do you ever spend a lot of time reviewing data, trying to make sense out of it? And do you often wonder how well you did last month, last quarter, last year as a reference point? Maybe you're looking at some data and you see the current month performance or current quarter's performance, and you wonder about what the trend has been over time and whether or not you how well you did during a previous period. Also, you ever wonder how well you're doing compared to your colleagues, competitors, the state of the country? I'm a pretty competitive person, so I'm always wanting to look at how others are doing if they're doing something similar to me. Not everyone is that way, but it's that question may pop into your heads quite a bit when you're looking at how well you're doing on something. How about as you're tracking a measure, say from one month to the next, and thinking about whether or not it's something you should take action on? Does that question ever come up as you're reviewing data? If you see a drop off in one of your performance measures and you think, gosh, is that enough for me to do something about, or should I continue watching the trend and see what to do with that? How about some related making decisions? Do you find yourself making them based on your gut instinct or prior experience, which in many cases is a great starting point, but do you find yourself doing it mostly because or only because you don't have data to that can help inform a decision going forward? And how about as you're looking at different measures, say clinical measures like diabetes measures, do you often think about measures that are occurring or related to the operational functioning of the organization, like appointment accessibility or wait time or no-show rate, and you know that there's a relationship, but you can't really quantify it? And lastly here, you often feel like you're very knowledgeable, or maybe there's a select few people in your organization that are really knowledgeable about performance data in your organization, but others aren't. And that could be due to a variety of reasons, but do you ever have that feeling that maybe data isn't spread as broadly as it should, or shared as widely as it should be from top to bottom, or from across an organization? And then lastly, do you wonder about the priorities that you set, about whether or not they really should be priorities, whether they're a goal that you set at the beginning of the year, or as you're reviewing quarterly data or even monthly data or monthly performance? Do you wonder about the priorities that you set and whether or not they really should be priorities? So if you have these questions, and I'm sure many of you do or have selected questions like these, then hopefully what we're going to be talking about here is will help frame some approach to take in helping your organization improve its ability to track data and truly integrate it into the culture of your organization. So this session is all about an approach to reporting that has evolved over the past 20 years. Dashboards have been around somewhere in the 20-21 year range. They were a model that came out of Harvard Business School. Kaplan and Norton were two guys who were studying organization effectiveness and how well organizations use data to optimize their performance and make things run better. And so they came up with this idea that when you bring data elements together from different parts of the organization, like from operations or like from human resources or from a customer focus or from a financial domain, if you can bring all of those measures together in one spot, it creates a much richer approach to managing your organization. So those are some of the underlying principles of the dashboard report that we're going to talk about here and hopefully demonstrate their application. The second thing I was going to cover is a little bit of background on data validation. Over the past few years, many of you have been going through electronic health record implementation, and data validation is always a hot topic as you are implementing or as you're in your post-implementation stages. You are wanting to make sure that everything that is going in is accurate and reliable, and that what you're doing with the data once it comes out is going to give you meaningful information about how you're managing your clinical processes or even administrative processes. So I wanted to do a little bit of a refresher on data validation basics. And you want to make sure as you think about your dashboard reports that the data going into them is accurate and reliable, and that as you bring those dashboards out to your organization, you feel comfortable and confident in speaking to the data and its reliability. And then the third thing we're going to do towards the very end is getting to a beginner dashboard design. I sent out and we have posted a beginner template for a dashboard. It has 6 graphics on it, and what I wanted to begin the discussion on dashboard design during this segment, and then in our next segment next week, we're going to get into some more advanced design features for a dashboard. But I mainly wanted to demonstrate to you during this segment how very easy it is to put a very basic dashboard in place for your organization, and hopefully I'll be able to convince you too that it's worth the time to do it, to reorganize your data in a dashboard format and have it help you create many efficiencies in your organization, not only analytically but also in meetings. One of my strong beliefs is that when you organize data effectively, you save a lot of money and people's time, because as you're sitting in a meeting reviewing data, if you can put it in a very visual and visually pleasing way, that you will help that group of people draw conclusions much quicker about what to do with it, and so you can have more substantive dialogue about making change in your organization. So I think data, having a dashboard format in your organization is something that I believe improves, just by putting one in place, it creates some efficiencies in your leadership and management time. So it's no big secret to any of you, I'm sure, that there have been big changes in the industry. Many of you have been going through this is my 2-lump hypothesis, that there's a huge amount of work that everyone went through, or maybe you're in the middle of going through with an EHR implementation, and that change curve was very, very high, and the change lump very narrow, because you had to do this in a fairly rapid amount of time. But what you may be finding yourself in now, and what most of the industry is finding itself in now, is this maybe more prolonged lump of change around what to do with all the data coming out of the EHR. And that area of change is referred to as either data management, analytics, or we're now starting to see the term big data show up quite a bit as the term that's describing all of this data that has come out of electronic health records, and the industry is wanting to make sure it's doing something valuable with it. Here's what hopefully you have hopefully are near the end of this path of moving from paper to electronic, and really it's a tough journey, but there's been some fundamental changes in the industry that we need to make sure we change our or build our capacity to work in the new electronic age of healthcare. And I'm sure this is maybe what it feels like, a big tsunami of data where you are the unsuspecting clinician and or administrator or manager in your organization and thinking very optimistically about all of that data, but in reality it could just come wash over you and be very overwhelming. This segment is sponsored by the California Healthcare Foundation through the RISE project, is aimed at building capacity and in data management and analytics, and this segment is aimed at some of the beginning principles of a good format with data. So I wanted to begin here, and after I get through this segment, I'm going to open up the floor to you for some questions. But I wanted to begin on by speaking to just a single performance measure, and begin setting up the scenario for what you do with one performance measure in your organization. So here's a display of a performance measure that we have 5 data points here that range from 30.4% up to 30.6, up to 31, up to 35, up to 34.8. So we see a trend here of 5 data points, and we're going to start dissecting this and see what changes in our perspective as we begin looking at these data. And some of the questions that probably immediately pop into your head are, first of all, what's the measure? So what is this measure? We see 5 data points. We want to know what it's for. And it is actually A1C less than 7, the percentage of hemoglobin A1C test that diabetic patients with a value less than 7. That immediately gives you some context of what's going on with these data over time. The next question is hopefully something about the time period. You look at these 5 data points, and doesn't it mean 2 different things, or even 3 different things, or 4 different things? If these are daily readings, maybe this is 1 day of measurement, maybe this is 1 week of measure, or maybe these are weekly measurements, maybe these are monthly measurements, maybe these are annual measurements. So very important in interpreting and appreciating the context if you know what the time period is. Well, these are actually these are 6-month readings over approximately a 3-year period, and so we could see that the picture is beginning to emerge about what's happening with these data and what we may want to do with it. The next question, for those of you who are, who know this measure, you know that the direction up is good, but it's always very important when you're speaking to a measure and when you're displaying a measure that you put an arrow in and indicate which direction is the right one that you want to go in. Many times there are people reviewing these measures that don't have the background that you do, and they should be invited and are more than welcome to ask questions about why performance may not be going in the right direction. So you always want to help users that maybe don't fully understand the measure. How about the benchmark on here? Well, what if I were to share with you that that the national performance on A1C less than 7 for Medicaid providers, this is a value that comes out of the NCQA annual State of Quality report. It's a must-read for those of you who are QI professionals and sharing data in your organization, to go to that report and pull off some benchmark figures so that you can track your relative performance. So what if I told you you were, 35% is the Medicaid national average. We know in most community health centers, the Medicaid populations are typically the highest percentage of patients, and so we've got the payer right here on as a comparison group, and the national average. So what do you think about that? That's right around the midpoint of where a middle of the road provider is performing on this, and If we view this, if this is on my organization's data, and then say, oh gosh, looks like I've made some improvements over the past 2 or 3 years, and I'm now at the average. But what hopefully is burning as well in your mind is, gosh, can I be better than the average, or is my work done? And so what if I were to tell you that the national best on this measure, or benchmark on this measure, is at the 44% level? Doesn't that, in one click of the button and in one display of this pink line, change your perspective on how well you are doing? If you're looking at this graph and and it's your organization, as short as 30 seconds ago, you might have felt really proud about this. You might have thought, gosh, I've made some great improvements, and I've hit the national average on here. And now I see a pink line that completely changes my perspective and maybe gives me a reason to consider that there's still more improvement that I need to do. So again, very important to see how context of data is so important, and external context is so important. And then lastly, what if I were to share with you that another payer class, commercial providers, are performing at the 51% measure on this level? We tend to narrow our comparisons in community health to Medicaid populations because those are the majority of patients that we see, and certainly there are challenges associated with treating Medicaid populations related to compliance and so on versus commercial populations. And so we, many times we'll just focus on the Medicaid population, but what has been demonstrated many times through the Health Disparities Collaborative out of the Bureau of Primary Health is that there's a number of areas where community health centers outperform the industry and outperform commercial providers. And so I would submit to you that it's not, it shouldn't be outside our consideration to aim for performing at the commercial insurance level. So what we see here, and hopefully you can kind of trace the change in perspective that you've had from the very beginning, where we just saw 5 bars on the page, all the way up to adding these 5 new pieces of information about the context of the graph. And hopefully what reveals itself is how very important it is to take the data that you are getting out of your electronic health record and those performance measures that you're pulling out of the electronic health record or through your analytic system, and displaying them against a relevant benchmark and absolutely against an internal goal that you are setting. And this is one of the main messages in developing a dashboard, is that every graphic you place on a dashboard should have all of these components on them, because they are the key to doing the most with the data that you have. So we might be content at this point to say that we just have one good graphic and a good graphical design down, and maybe I've convinced you that this is the format you should use for every one of your graphics. But really, this is only half of the picture here in all of our organizations. And what I'm speaking to is the importance of not just having a good graphic. You might have this phenomenal graphic that you created in your QI department or your IT or analytics staff has created, and it's beautiful to them, whoever designed it. But what happens with it once you bring it into a meeting? And this raises the other side of what are often referred to the 2 sides of a performance coin. One side of that coin is the display of the data, or the tools that you have to analyze data in your organization. And the other side of the coin is the culture in which you bring that data or introduce that data and use those data to make change in your organization. And so with this graphic, bringing it into a quality committee meeting or a physician meeting or even a board meeting, that you should immediately be triggering some dialogue around whether or not this performance level on this particular measure is a priority. That might be one of the first questions you have, is Is this something we should, is this a measure that we care about? Do we have 100 diabetics in our organization, or do we have 5,000? So should we pay attention to this measure, number one? If yes to that, what do we do about it? And usually the first question on that, it goes to who's responsible? Well, is it the clinical quality committee? Is it the internal medicine medical director? Is it the internal medicine or provider staff or family practice staff that treat all the diabetics? Who's responsible for doing something with this measure? Next question, what resources are allocated? Maybe, something like this measure is being discussed in a annual or in a monthly manager meeting, and you recognize that you need to do something about it, and you look around the table and everyone's overwhelmed and has plenty of other things that they're working on. So how do you carve out and create a dialogue around allocating resources to make some change with that? So we'll talk about that a little bit later. And then lastly, one of the more difficult things in the quality culture and performance culture in an organization, how do you hold someone or some group accountable for what to do with these data? So you may, this may get reviewed in one of those forums mentioned, but maybe there's no accountability for it at all. And so maybe the measure never moves at all or never moves any higher because there is no accountability for it. So we'll talk a little bit more about that as well. And what I would summarize here is, and hope to convey to you, is that there are two very distinct components of good performance measurement and management in your organization. And one of them is the display of data and the importance of a smart data display. And so that's illustrated in this graphical format. And every performance measure that you have in your organization ideally will have all of these attributes to it. And then secondly, what are you doing with that report once you have created it, once you created that chart or series of charts? What are you doing with it, and how are you using it in your organization's committee or meeting forums to move and, to move your organization forward and make change with it? So if you're brought in to doing that with one of your measures, then the next thing I'll submit to you and try to convince you of is the importance of putting these measures side by side with other related measures. So here's our performance of the A1C less than 7. And, looking at that chart just by itself certainly tells you something, as we discovered in the previous slide. But aren't you wanting to know more as well? And aren't there other measures that are correlated with this measure and related to it that will help even give further context to performance on this measure? And so the first thing that might pop into your mind is, well, okay, great, I know the A1C less than 7, but isn't compliance maybe a first order of business here? And don't we want to make sure that we're bringing all of our diabetics in for their A1C testing every 6 months per guidelines? And, so certainly to display the A1C less than 7 may mean a whole lot more, and arguably is, a second order of business to whether or not you have good A1C testing compliance. And so we see the performance on the A1C testing level is actually showing a similar improvement trend and has trended upwards towards benchmark levels, actually much better than the A1C less than 7. And so whoever or whatever this provider is whose data we're looking at, or maybe this is an organization, or maybe this is more than one organization, whoever it is, they're doing better on their testing to begin with, and it looks like they aimed mostly at improving their A1C testing levels first, and then began looking at how to improve the A1C less than 7 measure. Well, now that I've kind of teased you with about who this may be coming from, I'll pose that question: who do you think this is coming from? Well, let me share with you the next most important measure that adds context to these two graphics is the volume of patients that this measure is addressing. And what we see here is that these are results not from 10 diabetics or 100 diabetics or even 1,000 diabetics. These are performance measures from over 100,000 diabetics. So these results we've been looking at are actually the data that have been compiled through the AQUIC project, which you may be familiar with. This was an effort prior to the RISE project that brought together data from over 100 centers from across the state and pooled it together to collectively move the state forward. And so you can see here where, whereas you were looking at that A1C less than 7 or that A1C test value in one way maybe a few minutes ago and thinking, oh gosh, that's something that maybe I have some control over and that I can make some movement on. The mere display of how many diabetics this are may scare you off and you go running thinking, what am I supposed to do with 100,000 diabetics? So again, you see, whereas we're piecing together or putting together a picture here of measures that are very, very important to put side by side with one another because they tell a story, and it's valuable to look at them together rather than individually. Let me go a little bit faster here because I want to move us along. The next measure we might want to introduce here is the LDL test, and here we see again improving compliance with that measure. Doesn't that add a bit more to our perspective? We see that our A1C testing is doing a little bit better than the LDL, but there's still opportunity on the LDL testing. And then how about if we look at LDL less than 100, and we see that overall these LDL readings are performing a little bit better than our A1C testing. And so, if we're reviewing these data, we're probably prioritizing our A1C efforts a little bit higher than our LDL efforts. And then how about another measure to pop in here? So these are all related just to clinical data, but what if I were to tell you or show you that the EHR implementation status of all of the organizations participating in this effort, and I told you that 71 of them were implemented, that the remainder of them, a good 50, 75, are in the process of implementing. Doesn't that add additional context to your review of the performance measures? Because you might be thinking, my God, we're not budging this measure an ounce because we are in the middle of our implementation, and there's no way I can change something or make an improvement while I'm deploying electronic health records to all my sites and coaching and training everyone. So this gives an example of how a measure, an operational measure, adds additional context to your review of the data, and may have even, if you had a measure or if you were reviewing these data during the midst and thick of your implementation, you might have given a little bit of forgiveness to your organization for measures not moving up as quickly as maybe you would have liked them to do. A much better measure that I think is more operational and tactical and relevant to putting side by side with these measures is the mean third next available appointment, because this is a measure that really strikes to the heart of access to the clinic. And so, that A1C testing compliance is not going to be doing so well if it's taking you forever to get patients into the clinic. And the statewide averages of days to third we see over a shorter time period. Notice the time period on here is just over a 2-year period versus a 3-year period, but we see it steadily increasing on average for all of these centers. And so, certainly that was a challenge in moving the diabetes measures forward, is that there were some appointment accessibility issues, which, may have related to implementation of the electronic health record. Maybe there were other issues. And so, in conclusion here, you see that, and hopefully I've painted a picture for you, that by viewing measures from multiple domains, clinical, operational, and we'll talk a little bit later about financial, helps you tell a much richer story with your data than a single measure, and it helps you have a much better discussion as you're reviewing it with a larger group of people, because what is that group supposed to be doing? It's supposed to be making a decision about what to do with the data. And so hopefully this demonstrates to you the importance of not only good individual graphics, but the importance of bringing multiple graphics together on a single page so that you can look at their relationship to one another. I'm going to pause here and just see if there's any questions or comments from our audience here. We'll see if anyone, please feel free to type something in the chat box or the Q&A box, but I just wanted to take a breather myself for a few seconds here, but also give you an opportunity to jump in. I would invite anyone that has a experience related to these measures or a similar one to talk a little bit about how they have valued the importance of putting measures side by side with one another, or any examples to share from your clinic. So please chat away, or we'll see if we can turn off the mute and open up the floor to some questions.
I understand Mr. Rollover. So I have them.
Yeah, she can sit on my lap anyway. She's a 4-year-old. She's well behaved.
You accepted it and it was rolled over.
I didn't want to miss the opportunity to say hi to all my friends, and Jackie's planning to be there. So.
No, it's 9,000.
And you need us there by 7:30, correct?
Yeah.
Okay, it sounds like we have someone in a meeting separately.
Okay, sure. Okay.
Mm-hmm.
Okay.
Do you have a question or comment from the audience?
No, because I didn't do it from Great West. I moved it over from an IRA from an American Funds.
Okay. Thank you.
IRA that I had, and they did code. I'm looking at it. They did code it at 1099.
Okay. I think I'm going to
good.
remute. Yes, let's remute here. And sounds like we have some people who are multitasking, not uncommon, right? And I'm going to move along here because I don't want to. I just wanted to give an opportunity for any of you to pipe in with any examples. But let's move along here so we can get to some of these other topics. So, if that wasn't maybe daunting enough to take a look at diabetes measures and days to third, if that's one population of patients that we care for, and it happens to be a very important population, and certainly relative to the healthcare sector, diabetes management is a huge area of focus and will be for many years. But if that wasn't daunting enough, there's as you can see here, that many other clinical measures and many other populations, many other disease conditions that patients that you are caring for in your organization, and so to have just those 6 charts on a page about your diabetic population really doesn't cut it fully, because you've got many other populations that you're caring for. And this highlights again the importance of having an efficient and effective and very focused set of reports that are going to cut to the chase and guide you visually towards priority measures. And at the bottom here, showing this isn't just about clinical measures. We've got operational measures, your days to third, your no-show rate, your cycle time. These are all very important measures to be managing to as well. And certainly finance measures are something that mostly have been the domain of the finance staff in your organization, but these are becoming increasingly important for the broader care team to be reviewing, because of pay for performance initiatives that are driving those incentives and the financial health of your organization. And so we just have lots and lots of measures that we're managing to, and so it further solidifies the case for having an efficient dashboard design. So my question to you, are all of you ready for this, ready to dive into that tsunami? I hope so, or if you're not, I fear there we're all going to dive in anyway, or we're currently swimming. So moving on here, I wanted to share with you just some general principles for dashboard design. By the time we wrap up here, I'll show you a few examples of dashboards and show you some of the basic functionality. But I wanted to give you a framework and a guide for general dashboard design. And as you begin thinking about and using dashboards in your organization, one of my the frameworks that I have used for over half of my career is the Baldrige Performance Excellence Model, and this is now used very widely in the healthcare sector. A good half of its applicants and winners every year are from the healthcare sector. So it has been the use of it has been mainly on the acute care side. But there have been a number of community health centers that have applied for it as well and use it as well nationally. But it is just an excellent framework that I use in my QI practice, and I would encourage all of you to take a look at it. It's through the National Institute of Standards and Technology, and if you Google Baldrige, you'll get straight to their site where there's a number of case studies, and there's even a community health center case study. So this is my framework for dashboard design, and the best practice of dashboards actually came out of the Baldrige framework. Every organization that applies for that award typically has a dashboard that they're using in their organization. And so I just wanted to point that out without going into detail about the Baldrige model itself. Wanted to refer you to that separately. And what it does, what the model does is provide this very strong context for the use of data management. What are the categories and the criteria is data management? And you're challenged to ensure that the measures that you are using align with the industry. And so you're encouraged not to design your own measures, but rather use those that have been defined and have industry relevance. You are also challenged to ensure that the measures you put on your dashboard match up with a plan that you've created in your organization. So, those beginning of the fiscal year plans that you all sit down and take maybe 1 or 2 or 3 meetings to pull together prior to your fiscal year every year, where you decide on what the important things are to focus on and what what measures you're going to pay attention to. Your dashboard should match directly to that plan that you have created. Now, I know I was half joking when I was describing that process that is actually a challenge for many organizations. It's usually one of the first questions I ask when I go to a new organization. Even before I ask for their dashboard, if they have one, my very first question is, what is the plan that you have? Show me what you are aiming for your organization to do. And certainly from a performance standpoint, it's critical that you have that plan developed, or a plan in your organization that is guiding what everyone is looking at. And then the last guidance that the Baldrige has in the design of dashboards is ensuring that you are displaying performance measures from across all the functional areas and from all domains. And so we saw that in the example we did where we were displaying clinical and operational measures, but certainly there are financial measures and patient experience measures that would also be valuable to put side by side with those measures. So these are just some basic principles that the Baldrige criteria challenges us with as we're creating our dashboards. And as we look at some detailed best practices about the formats of dashboards that have come through out of Baldrige winners, we see that to have dashboard formats with a trend and time chart with internal goals and external benchmarks is really, really important. Use of stoplights to indicate your status is really, really important. I'll show you an example of that in a second. The dashboards that you put out there are aligned with that strategy and that annual plan that you developed, and that you have a similar look and feel to the dashboard, so that someone looking at another department's dashboard could pick up easily on the performance measures and their trends. And then lastly, I refer to an aspect of the design as the horizontal and vertical alignment of the format. And what this means is that as you look across departments in your organization or across divisions or across sites, you have alignment of measures that are relevant. So for example, third to next available appointment is something that applies to every clinical department. The clinical measures might be different across departments, but third next available appointment is something you should see in every clinical department. And so you want to ensure that horizontally you're using the same measure in all relevant departments. And then vertical alignment, the format, is where you see a pyramid almost of the formatting where, you know, at the operational and front line level, you might be reviewing a much broader set of measures. But by the time you get up to the board of directors and you are sharing a dashboard with them, it may only consist of a, you know, somewhere between 5 and 10 of the most important performance measures. And so, you know, we named off in an earlier slide up to, you know, 50, 75 performance measures. You know, and your managers and staff in the organization may be looking at those monthly and wanting to trend all of them. But when you are, you know, rolling up the performance across sites or and across providers and sharing it at a very high level, you want to narrow it down to those key strategic measures that are important and strategically managing the organization. So again, here's a repeat of that basic dashboard format. I just wanted to refresh your memory on that one. And here's an example of an individual stoplight report for a provider. This is another very effective format that is more tabular in nature, where you take the measures that you have and color code them. And Excel has some nice functionality where it will automatically color code based on criteria that you set. We'll be talking about that next week, how you can use Excel to color code, to auto color code items. And you can see how very important a report like this can be in taking your data down to an individual provider level. So the previous report you may use at a departmental level or even at an organization level, but this is the type of report you may want to share with your providers once a quarter, and you know, maybe have a dedicated session where the medical director is handing out these reports and sharing them and having a dialogue with individual providers about their performance and how they contribute to the overall performance of the organization. So this is just another best practice display. In terms of best practices in review of dashboards and meetings, the best place to start whenever sharing data is to recognize the improvement. So always focus on positive things that have happened first, and acknowledge people, acknowledge departments for their efforts, and you know, that sometimes has to happen outside of those meetings as well in terms of rewards or awards to staff. So make sure you're recognizing improvement, acknowledging improvement. And then next, what should be happening is a scanning of trends across all the measures. And if you have that nice display of data, it becomes very, very easy to just scan across 6 charts and visually identify where trends are going in the wrong direction. And so those are the ones you want to pull out and begin a dialogue on so that you can try and preempt any potential issues. And then you want, after a few minutes or more of understanding those trends and dialoguing on what's relevant and what isn't, you want to identify what are the priorities that you should be paying attention to and develop a plan on what to do about those items, establish what goals you want to set for making the improvement, and then lastly, assign responsibility and allocate resources. On accountability, I wanted to just pull this out and focus attention on it. As mentioned before, I think this is sometimes, many times, I should say, overlooked in organizations. We go through a pretty rigorous exercise of bringing data together and discussing it, but then we fall when it comes to accountability. And so this is just a really important area to pay attention to in moving performance forward. And as I mentioned previously, a good measurable plan is the main reference point for accountability, and there should be names next to that plan so that you immediately know who's responsible for what measure. You want to ensure that the goals between your different committees, from government down through leadership and staff, are aligned. You want to give ownership to certain committees of selected measures so that they are tracking and monitoring them and asking questions about what they're doing. And then last but not least is incorporating goals and incentives into performance management plans and reviews and incentives and provider contracts. So this is an area that I think it has a lot of there's a lot of potential for this in community health. And you know, so that's internal accountability. And then as we think about externally, well, we are, you know, we're entering into an age where public accountability and transparency is a given. And you know, health reform through accountable care organizations are going to make accountability and transparency a business imperative for community health centers. And so we can't underestimate where the importance of just being very transparent with your data and holding yourselves as an organization accountable to it. I wanted to pause here and see if there are just any questions or comments about the last few slides, and again invite you to make any comments on the chat board. And I think maybe we can unmute or see if there's not any noise going on there. But invite those of you with any comments at this point. Oh, it just occurred to me. You guys are, this is the mid-afternoon block. It's 1 or 2 hours post-lunch, and I bet some of you are eating the cookie left over from lunch and just kind of kicking back. So anyway, I'm just kidding. Not seeing any questions here, and no one is speaking up, so I want to take that cue and move along here to data validation. And here I just wanted to pause for a few minutes and reflect on the importance of data validation in your dashboarding and making sure that you have all your data validation basics under control and are tracking a few things. Because, you know, if you are presenting your dashboards, and it is inevitable someone is going to dig deeper and ask questions about the reliability of your data. And so it's very, very important. What I've found in the post-EHR implementation days of the network that I used to work at here in Chicago is that it was inevitably the very first question you get when you're reviewing performance measures is, what are the definitions? What's the numerator? What's the denominator? What's the exclusion criteria? And even more explicitly, where did it come from in the EHR? And so you want to be very deliberate in your organization with educating people about the measures and taking time, not just in those meetings, but in, you know, where management and leadership staff are coming to, but make it a staff education session as well to educate everyone about the measures and where the data is coming from in the system and why it is important to have good data going into the system. I learned this very early on about how important this is to engaging people in your organization in using dashboards, is that they want to feel comfortable with the data and they want to know where it's coming from. And so take some time, even if it is a whole meeting 1 month, to just go through the data and educate people go through the measures, and educate them about the measures and where they come from in the electronic health record. Thankfully, we are, and hopefully many of you are getting past the stage where you have to sample data, and the UDS requirements on random sampling are at 70. I think those days hopefully will be gone soon for many of us. But if you are still doing it, make sure that you are using representative and random sampling, and that usually means getting a population list and randomizing it, and with random numbers that you can pull up in Excel, and then pulling those charts and reviewing the data. So if you are still doing paper chart audits with your data, make sure you're doing it randomly, and that 70 sample mark is a good one to aim for as your before given measure as you're pulling data. If you are pretty solidly in EHR land and using a EHR report writer or a warehouse off of your EHR or some other disease management system off your EHR, make sure that that system is computing the performance measures appropriately, and that inclusion and exclusion criteria are being have been defined appropriately. And a good way to check against this, which is a good exercise to do initially and then periodically, just to ensure that those measures are coming through accurately, is to run frequency tables and cross-validate patient totals and system utilization. System utilization I've got on the next slide. I'll talk a little bit more about that in just a second. And what what should be resulting as you do some of these data validation exercises is that you're likely going to find issues in 2 or 3 different areas. One area might be that you have some.
Hello?
Oh boy.
Yes, ma'am.
Oh, I think we need to use
Okay.
So 3 different areas that you likely will find issues in are: 1, clinical content. As you're looking at your performance measures, you and see a decline because of that. Could be a clinical content issue or a screen flow issue. And as you learn that information, bring it to the right place. Use that to inform your EHR optimization roadmap, which if you don't have one, create one, and to help it, use it to guide those improvements that you're making to your EHR over time. Those optimization roadmaps really should never die. There's ongoing optimization that we all need to do with our EHRs. And so as you're reviewing performance measures, make sure as you come across issues related to clinical content or screen flow that you bump them over to the optimization roadmap if that's appropriate. Ensuring reliability of interfaces is another area of where data could be coming through poorly. And so that's another IT domain issue that if you uncover it in your performance measures, make sure that it gets to those issues get to the right people who can manage accuracy of those interfaces. And then lastly, if you've gotten through those technical causes behind why a measure might be declining or behaving strangely, then what quite often is left over is just a true performance issue where you've got to just do something about making change. And maybe it is a compliance issue with using the EHR that is a leadership issue for to tackle. So lots of different or a few different things that you want to scan for as you're reviewing your dashboard related to data validation, and put those issues in a separate bucket, but make sure you are tracking them and managing them. And here's some examples of how you could take data that you are pulling as you're testing validity of your data, how you can put them into a graphical format and review periodically. This certainly, if you've got some of your system use measures under control, you don't need to be rigorously tracking them, but some of these measures are really good to periodically track, including unsigned documentation, looking at just complete compliance with completing different forms. This is an example of a diabetes form from our organization that we uncovered early on, thankfully, where our beautiful diabetes forms that we built were just not being used. So we focused on that as an improvement effort. Beginner dashboard design, I'm going to jump over in our remaining minutes here to just a basic dashboard design. And let me switch over here. I just wanted to point out to you, and if you are just beginning your dashboard journey, and I think many of you are, this is an example of how you can take 6 basic measures in your organization and bring them together for your starter dashboard. And this is an example of the A1C less than 7 measure. You might pull in a preventative care measure like cancer screening, pull in an operations measure like days to third, bring over your satisfaction data if you've got, or pulling that together monthly or quarterly or semi-annually. Provider productivity, a good one to put side by side, and maybe net patient revenue. This is just an example of where you might think about starting your dashboard journey in creating one for your organization. And ideally, these measures should match up directly to your organization's priorities and their plan and what you are focusing on for a given year in your organization. So that's just an example of a basic dashboard design. The Excel template for this is available on the RISE, on the CHCF website, and so you can take a look at this. And we're going to be going into this spreadsheet in detail next week, so I'll talk a little bit more about this next week. And then here's a second example, which is the template that we've designed for the RISE effort that adds in addition to the graphical displays, there are also some Stoplight summaries of the data. And so this is a little bit more advanced design that we will be talking about next week as well. So I just wanted to show those as a teaser for our topic next week. And I'm in my final minutes here where I want to allow some time for people to ask some questions and or post something in the chat box. What I would challenge you to do is be sexy with data. This is something the chief economist at Google said a couple of years ago, and I think it's actually very much coming true that the job you have, if you're doing analytics in your organization, should be very sexy right now. And so keep it that way and make your dashboard sexy. This is a great area of focus right now in healthcare, and one you should be paying a lot of attention to and making it work the best for your organization. So that's all I have for now. I'm just going to pause here and look for any questions in the chat box or open up the floor for any voice questions. We do have one more session that will be replayed 2 times next week. Certainly, welcome any questions now and just examples you all would like to share with me, or you can type questions directly to me into the Q&A box. I am available not only for these trainings, but I'm working with your consortia offices, and so this is stage 1 of dashboard deployment as a general training. I'm going to be getting into each region and working with your consortia offices and individual centers, providing more focused support. So that will be happening as well. And I'm just going to stop talking and open the floor for any of you.
Hi, Jerry.
Yes.
Hi. So this website, chcf.org, is where we can refer back to this PowerPoint?
Yes, this PowerPoint is there, and there are 2 dashboard Excel templates, and there's also a recording of the session from Tuesday, and there will be a recording of this session as well, though it's pretty much the same one, just some of the content from the beginning won't show up. But yep, this is going to be the resource page for all of these tools.
Thank you. It was great information.
Absolutely, absolutely. You're all on your second cookie, aren't you? Okay, here's a question here. Is there a preferred format for presenting data on multiple clinics, displaying each clinic side by side, or for a single measure, or with clinics overlaid on the same measure? That's a great question, and I am not at all prescriptive about the way data is displayed. I think that different people receive and view data differently, and so something that I think is good may and effective for me may not be for another person. So I've used both of those formats, and I think that there are. I think you typically have or want to have a graphic that is trending the data. I think that's a very, very important thing to do with your data, is trend it over time and show that view of the data and give that perspective on it. And then you might pick the most current month to dig into and look at it by provider or clinic side by side. And then that's a nice way of guiding the discussion, is starting off at the top level and looking at the overall trend and then drilling into the detail. Great question. Yeah, there's be creative and explore what formats work for you and for the people in your organization. But those are both appropriate displays of data. I see the clock ticking 2 minutes past the hour, and so I want to release those of you who are either you've already left or you're wanting to leave. So I want to wrap up for those of you who need to move on to something else, and maybe we'll turn the recording off here, and I'll just hang around here if you don't want your your questions to be recorded. If you want to chat with me, I'm going to stick around here, but we will conclude the recorded portion of the training here, and I'll just hang around here for those of you that maybe want to ask a few more questions. Thank you very much to all of you for participating. This is great. I hope you got maybe a few things to help you, and we'll dig into the dashboard design in a bit more detail next week.